My name is Laura Schoenborn. This is my presentation on the Older Americans Act and the Affordable Care Act. The Older Americans Act was passed in 1965 in hopes of improving the lives of the elderly. Congress wanted to find a way to support the lives of the elderly. One aspect of the act that helped support the elderly was the elder justice. Elder justice is a way of stopping elder abuse, which is a problem that can happen to any older person by any trusted adult. It can happen either physically, mentally, emotionally, or financially. Older people can get financially abused so many times by anyone, like a caregiver just taking money at a random time. The OAA created the Administration on Aging, and it required the Administration on Aging to prevent elder abuse. It prevented elder abuse by providing information to the general public on the issue so that people can notice when people are being abused. And it can also provide support to the elderly who have been abused. Social workers can step in and take the elderly to nursing homes. The Affordable Care Act, however, was passed by President Obama in 2010. It is more commonly known as Obamacare. The act was passed in an attempt to make health care more affordable for everyone in the U.S. One section of the act that Obamacare talks about is preventing chronic diseases and improving the overall public health of the U.S. citizens and the elderly. This section was designed to encourage people to eat healthier and live healthier lives. It gives people resources so they can find information on nutrition and preventative screenings it can help seniors. It provides seniors on Medicare with no copay so they can get preventative screenings on a regular basis. In an attempt to prevent chronic diseases, several different government agencies created a strategic plan called Healthy People 2020. Chronic conditions can be slowed by different disease prevention activities like exercising, stress management, nutrition, and substance abuse control. Exercise can help by keeping someone active, because if someone is inactive, it can cause weaker bone density and weaker muscles. If a person is so stressed out, it will cause them to get sicker and be more worried. Nutrition causes people to eat healthier. And so many people and so much substance abuse can cause people to get very sick. And so people do need to learn to control their substance abuse. However, you cannot just start doing these things at an old age. Doing these things requires a behavioral change. The elderly have to change their behavior if they want to start at a way to start doing these things. And behavioral changes cannot just happen. The elderly, you have to train yourselves to do these things. Behavioral changes can require encouragement and support from family and friends as a way, like peer pressure. If someone is pressured by their peers to start eating healthier, like you can just randomly start getting some of your friends and encourage them to go walking with you. Or just start making the elderly healthier meals and getting them to eat it. Those are ways to encourage the elderly and to help them eat healthier and exercise more.